Many of us are familiar with the notion of walking a mile in someone else's shoes. It's the idea that we need to see a situation from the other person's perspective to truly understand how they're feeling. Unfortunately, it's not always so simple. We may be able to easily recognize a physical ailment, but what about psychological ones like depression or schizophrenia? How can we gain perspective on an invisible disorder that we don't experience ourselves? Dr. Melanie Rosen thinks the answer lies in our dreams.
When I first got interested in the subject, I did a TEDx presentation on the subject, and my specialization is dreams. So I do research on dreaming as a delusional. What exactly is dreaming? And dreaming is often considered to be a delusion. So that kind of led me down the path towards studying mental illness.
And through her research, Rosen discovered a possible connection between dreaming, mental illness, and empathy. Rosen is an assistant professor of philosophy at Trent University in Ontario, Canada. She says that awareness and education on mental health has improved in recent years, but one area has stayed largely the same.
We all either know somebody or have different types of mental illness ourselves. But surprisingly, the research suggests that empathy towards mental illness has not really changed.
Rosen says empathy surveys over the last couple decades have charted some small progress, but overall there hasn't been much improvement. She believes the disconnect may come from a cognitive deficit in our ability to understand how mental illness affects individuals. Rosen says we don't seem to have the same detachment when we see physical pain.
It's very easy to empathize with physical discomforts, but there seems some limitation regarding other types of mental states, such as mental illness, in which people's attitudes are surprisingly unempathetic. People experience maybe disbelief about how serious the condition is, or even if it's real.
Some may even demand explanations, asking, what gives you the right to be depressed? In an effort to close this disconnect, researchers are using virtual reality headsets to help people step into another person's shoes. Though these studies are fairly new, Rosen says the early results are promising. However, virtual reality can only simulate the living world, limiting how much VR can feel like the real experience. It also can't control which emotions you feel during the simulation.
An example is anhedonia, the experience of not enjoying things that you used to enjoy. You can't really put someone in virtual reality and make them no longer enjoy whatever it is they usually enjoy. Or a delusion, for example. If somebody has the belief that their loved one has been replaced by an imposter, just an example, Capgras delusion. There's not really any way to replicate that in a virtual reality.
The simulation can show an image of your loved one, but it can't imitate the cognitive mechanism that makes you believe in the delusion. Rosen argues that the biggest obstacle is that people have to want to understand the experiences of those with mental illnesses.
You can't increase the empathy of somebody who doesn't want their empathy to be increased, or if they don't believe. You need to do something else to make the person believe what the other person is going to do. So admittedly, what I'm looking to is somewhat limited.
Rosen's area of study is restricted to people who want to feel empathetic, but due to a lack of experience or some other cognitive block, cannot. She theorizes that dreams can act as a delusion simulator that allows us to gain empathy as we sleep. The difference between VR and dreaming is that you believe that what's happening in the dream is real.
In your dream life, you have some very different types of experiences that you don't usually have in the day. And those types of experiences happen to be very similar to, in my view at least, what a person who would be undergoing a delusion might be having. And because you had that experience now yourself, it seems like you should now have more cognitive resources, you could say, for empathy.
Rosen's ideas were recently published in the International Journal of Dream Research, and while there's still a lot of mystery surrounding dreams, Rosen's trying to take what we do know and use that information to increase our empathy. She's currently planning a dream study that hopefully uncovers more answers. However, this research has many challenges.
How do you get somebody to have an experience? Do you have to be aware that you're dreaming and remember the dream when you wake up?
All questions that drastically limit Rosen's research. One option is to run a large study and give everyone a dream journal.
So collect dream journals from people and look at the kinds of dreams that they have on average, and then look at their ability to empathize, do some tests on, let's say, the ability to recognize facial features or expressions, or, ask them questions about someone and see how good they are at interpreting what someone is going through. So you could do tests on people and see, looking at empathy scales, see if people are better at empathizing who happen to have certain types of dreams.
This type of study is advantageous because it wouldn't require any technology. However, reducing the number of participants and using a dream lab could provide better insight.
So you get someone into a lab, you keep track of what stage of sleep they're in, which were relatively simple technology like EEG can very accurately say which stage of sleep a person is in. And people are more likely to have dreams in rapid eye movement, REM sleep.
REM sleep is also the most likely time for us to have bizarre dreams. If participants were in a controlled sleep lab, Rosen would try to wake people up in the middle of their dreams so they have a better chance of remembering the situation.
If you had people like trying to remember their dreams and reflect on them, and instead of just waking up and going, oh, that was weird, thinking, okay, well, actually, some people might experience something like this when they're awake. So you do this kind of test where you tell people your dream was kind of like what this person experiences and get them to reflect on their own experiences. Then you could do empathy tests and see if that would improve empathy in individuals.
So while Rosen can't directly influence someone to have a delusion-type dream, she can help them navigate the experience whenever it does occur. She'd be able to walk participants through their dreams and connect the emotions they felt while sleeping to the ones people with mental illness feel every day. But both trial options have one main issue. Rosen says dream experiences could mislead people into assuming certain ideas about mental illness that aren't true, therefore creating an even greater gap in societal empathy and understanding.
If I happen to be really violent in my dreams, so this is something I've heard people report as well, that, they would never in their life punch somebody, but in dreams they're going around punching everybody, or they kill people in their dreams. But if somebody was to infer that my violent dreams are what it's like to have a certain type of mental illness, that would give them an accurate depiction of what people experience and might make them less empathetic. So be afraid or want more increased social distance.
Rosen recognizes that these assumptions could harm the progress of social empathy for mental illnesses, but we won't know anything for sure until her theory undergoes further testing. You can find more information about Dr. Melanie Rosen and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Twitter, and Instagram. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Nancy Benson.
Coming up next week on Radio Health Journal.
I gave birth. The only difference between me and what feels like everyone else is that they were able to go home and put their baby in the nursery, and I was not able to do that.
The conversation around stillbirths that's long overdue.
Then cutting-edge technology that's helping improve communication for the physically disabled.
So instead of communicating one letter at a time, we could instead use this technology, and instead of going letter by letter, have the computer read out word by word the words that they're trying to say.
All that and more on Radio Health Journal.
I'm Nancy Benson, host of Radio Health Journal. If you enjoy listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
The broccoli lobby isn't a very powerful political force, whereas the cattle lobby really is, and the sugar lobby really is.
Rebalancing our food production efforts. Then,
I think life should be enjoyed. And I think that there are pretty simple habits we can build into our lives that can make any given day feel better.
The time management habits that stack up to make a big difference. I'm Marty Peterson.
and I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Viewpoints on your favorite radio station and subscribe and listen to shows anytime on Apple Podcasts and Google Play.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.